Disease management in the United States. Disease management is another way for healthcare to educate patients on how to manage chronic diseases. With the direction of education, the patients will learn and understand how to manage their disease and take care of themselves. They will be educated on these things to avoid and the things that they can be potentially harmful and make their disease even worse. The actual reason for educating patients about disease management is to help them improve their quality of care. Main parts of disease management. Disease Management Association of America has pinpointed important factors of disease management. Being able to identify specific patients in which diseases should be mentioned and how the patient can enroll in actual programs. Having guidelines for evidence-based practices that have been formed to maintain. Being able to form the model for the practices, including physician, disease managed coordinators, and the use of nurses, pharmacists, and even dietitians. Developing a program to self-educate the patient for them to be able to manage their disease at home. Diseases that are considered to be chronic: heart disease, including congestive heart failure, coronary heart disease, and hypertension, also known as high blood pressure; lung disease, including chronic obstructive pulmonary disease, known as COPD; liver diseases, diabetes; psychiatric disorders such as a clinical depression; Alzheimer's disease and other dementias; cancer; arthritis; osteoporosis; sleep apnea; obesity; and asthma. Patient participation in the U.S. Patient participation is also called shared basic leadership. Is a procedure in which both patient and doctor add to therapeutic basic leadership process. Under the working work frame, healthcare suppliers enclose medications and contrast options to patients so as given important assets to patients to pick a treatment choice and most nearly adjust to their own social kind and individual convictions. Controversy, the present predominant type of medication and biomedical consideration framework places doctors in a position of power, with patients assuming an inactive part in consideration. Under this worldwide known therapeutic partnerism, doctors teach patients about what to do, and patients frequently take after the doctor's recommendation. Moderately, as of late, be that it is may, that a general movement has happened in which patients are more required in therapeutic basic leadership than some time recently. In the late survey, the 115 patients interested concentrated, for instance, found that larger part of respondents like to take interest in reservation basic leadership in half the studies preceding 2000, while 71% studied after 2000 found the lion's share of respondents who would need to take part. Varieties in every strategy, including healthcare participation and patients' interests, might be favored in various patients. Healthcare coverage in the U.S. The Affordable Health Care Act provided to Americans to ensure improvement on health and being able for Americans to have comprehensive health insurance that will expand coverage to all Americans that are uninsured and underinsured. It will hold insurances accountable for their claims decisions. It will lower costs for Americans who pay too much for current plans. It will guarantee more choices in insurance plans and improve the quality of life for all Americans. Healthcare coverage in the U.S. continued. Americans can also purchase healthcare coverage from their employers. Government programs are also an option for unemployed, such as Medicare for the disabled and Medicaid for the unemployed. Disease management in Canada. In Canada, chronic diseases are considered to be long-term conditions that have developed over time and often progress to the severity that can only be treated and maintained, but not cured. The conditions in Canada are similar to the ones in the United States, such as cardiovascular disease, cancer, diabetes, arthritis, back problems, asthma, chronic depression. In Canada, diseases are amongst the older Canadians and have been developed for decades. In 2003, there was approximately 80% of the population over 45 who considerably about 3.7 million that were living with a chronic disease already. Like the U.S., disease management is very important for the well-being of the patient and for the preventability of high healthcare costs. Patient participation, patient engagement. Canadians consider it to be patient engagement that will happen when a patient is active and feels that their health is important. There is a collaborative reasoning on the governance of prioritizing their own setting healthcare goals with their physicians, being able to apply their knowledge, and the physician's participation in having the patient understand the education piece. In Canada versus the United States, engaging in healthcare research makes research more accountable and transparent, provides new insight that could lead to innovative discoveries, ensuring the research is relevant to the patient's concerns. The international experience with engaging citizens and patients in research has shown that involving them early in design of studies, ideally as early as the planning stage, leads to better results, said a Canadian physician. Healthcare coverage in Canada. Canada have a healthcare system that is considered to be socialized healthcare that provides all Canadian citizens and is a publicly funded and has been given out territorially based, follows specific guidelines set by the federal government. Under Canadian's healthcare system, each citizen is provided with preventative care, medical treatment by a PCP, as well as the ability to seek medical attention from the hospital, a dentist, and all additional medical services that may be needed. All citizens qualify for coverage regardless of their health, ability to pay, or their standard living conditions. Disease management in Europe. Disease management in different parts of the world can always be different and mean different things, and Europe is actually one of the quality and control groups in healthcare. There is numerous programs throughout Europe that can assist with the vigorous economy and that what physicians are able to consult to the best of their medical knowledge. There is a particular emphasis on the way that healthcare delivery system works in the nations where they are monitored and constantly audited, ensuring effectiveness and assuring the prevention education of each patient on their specific disease and how to self-manage. There is evidence that long-term cared patients have chronic diseases come with a high cost. Similar to the United States and Canada, they are both concerned with asthma, back pain, rheumatoid arthritis, dementia, diabetes is more effective in episode fragments care of individuals. Patient participation, patient safety in Europe. In Europe, they include the patient safety with the participation aspect, which means while patients are included in their treatment, they are able to review the side effects and adverse effects of their health care. They are able to make more effective and complex decisions. With the patient being the main focal point of their own care, they will be aware of any unexpected or even unwanted events that are being considered within their treatment plan. In Europe, every 10th patient has experienced preventable harm that could have been avoided if the patient were part of their own healthcare decision. Healthcare coverage in Europe. Healthcare coverage in Europe is provided through different ranges of systems that run on a national level of service. Healthcare coverage is funded publicly and taxation. Europe has a universal healthcare system. They are privately funded that helps with the cost of their own non-taxpayers portion of their cost. There is also private health that pays out of pocket by the patient or an employer. All of Europe may have other entities of the country where they have the EU insurance cards that help them obtain health services across Europe. The healthcare spending for United States versus other countries. US is at 17.1% of GDP. Canada is 10.2%. Europe is made up of several countries on this list. Looking at the different GDP, United States is still the highest and most expensive. Disease management comparison. The United States recognizes it as a controlled occurrence, puts as much effort into management as they do other illnesses, worries about high costs. Canada and Europe have publicly funded healthcare so disease management is a priority, puts a lot of effort to ensuring patient satisfaction, and doesn't worry about high costs. Patient participation comparison. The United States, Canada, and Europe all three believe that the patient participation experience safety regarding their care is most important overall. Education for patients on specific conditions they have and teaching them how to self manage is key to maintaining their disease important to their quality of patient's life. US and other country rankings, with the United States being in the top of the healthcare industry in cost, their overall ranking amongst other countries is a close call. Review the graph on the next slide to see where the United States compares to countries in the different rankings. My ranks for the three countries: number one, Canada and Europe should be tied. Number two, United States. Based on research I've done on all three countries, I find that Canada and Europe have their citizens' best interests at heart, with free health care for everyone and it being publicly funded and citizens not having to worry about their ability to pay. As for the United States, now I must say that I'm thankful that we focus not only on the quality of care but on the revenue cycle as well, or I wouldn't be employed. But I believe that patients' ability to pay should be set aside when it comes to their quality of life. Recommendations. I would recommend that the United States of America to focus on the quality of the patient's care and not the lining of their pockets. I believe that health insurance industry and the cost of healthcare should be under evaluation and investigation for possibly lowering the cost of care. Healthcare providers should focus on patient participation and making sure that all patients are educated on their treatment plans and be able to manage it themselves.